Hello, my name is Amna Shehzad, and today I'll be presenting study of medical tests which we all have studied earlier under the domain of choosing the best study design in research to publication. Firstly, the overview. We'll be discussing what are medical tests, differences between clinical research studies and studies of medical tests, test characteristics that are specificity, sensitivity, and reproducibility. Research questions associated with medical or diagnostic tests, importance of sample size in medical tests, calculation of sample size using CTSI sample size calculator, diagnosis of spectrum of disease versus non-disease, standards for reporting of diagnostic accuracy checklist, issues with the gold standards for diagnostic tests, analytical tools that are used for diagnostic tests, and then the summary. Medical tests. Medical diagnostic tests encompass a wide variety of physical examinations that are given by medical professionals to confirm the presence or absence of an illness or a disease in a person. These could be both invasive or non-invasive. Examples of invasive are regular blood tests, biopsies, etc. And non-invasive are the ones which require testing through skin, like testing for allergens. Though there are an overwhelming number of medical examinations used to diagnose an even more overwhelming number of ailments, they can for the most part be classified as fulfilling the following 5 rules. They could be confirmation or exclusion. That is, when a test is used to confirm or exclude a suspected disease. They could be triage. That is actually used to administer with a low margin of error in regard to false positive results. And it is basically an initial test. Then monitoring. A repeated test that allows for assessment of a treatment's efficacy, prognosis. It is an actually assessment of a treatment's outcome or the progression of a disease. Finally, the screening. It is used to detect the presence of disease in a person presenting as asymptomatic, that is, having no symptoms. So, what are the differences and similarities between clinical research studies and studies of medical tests? Apart from some major differences between clinical research studies and studies of medical tests, these hold two basic similarities. Firstly, the study structure. They follow the same study structure, that is, they have similar kind of pattern, that is, research questions, study design, sampling, outcome, predictors, analysis. Secondly, rule of generalization, that is, a result that is obtained from a small sample size can be applied to a general population. And secondly, the measurements that are obtained depict the similar phenomenon in every case, that you don't have to change every measurement as per the case. Now let's see the differences. They can be differed on the basis of three major principles. Firstly, the types of research questions addressed in each type of medical research and medical studies or the clinical research studies. Utilization of different statistics to depict the results. That is, the different statistics we use at the end to inference the results. And then the biasness that is involved at different levels. So, test characteristics. Earlier discussed that there are three specific test characteristics that determine the amount of that actually determine the efficacy of the diagnostic test. Firstly, the specificity. Specificity is the percentage of persons without the disease who are correctly excluded by the test. Sensitivity. Sensitivity is the percentage of persons with the disease who are correctly identified by the test. Reproducibility. It measures the degree of agreement of an experiment or study performed by different individuals in different locations and in different measure instruments. Both sensitivity and specificity are concerned with accuracy of a screening test relative to a reference standard. So, what are research questions? Research questions associated with the medical or diagnostic test. These could be of these categories. They could fall in any of these categories or apart from these as well. So, basic is reproducibility, accuracy, innovation, effect of testing on outcome, impact of results, factors associated with the test, variation in the test results by change in patient characteristics. So these are all the areas according to which research questions are developed as per the diagnostic test or the medical tests. So, what is the importance of sample size in medical tests? Diagnostic tests basically fall under the descriptive test, therefore, the traditional methods of testing of hypothesis cannot be applied to them. The purpose of the sample size in diagnostic tests is to determine the strength of evidence of occurrence of that particular disease. The sample size of the people having a particular disease is calculated based on the width of the 95% confidence interval and the sensitivity desired for that test. As earlier discussed, sensitivity is used to determine a disease in a person. Specificity, on the other hand, considers non-diseased person. The sample size of the healthy or normal people is calculated based on the width of the 95% confidence interval and the specificity desired for that test. Now, how is that sample size calculated? Sample size, we'll be discussing the calculation of sample size using CTSI sample size calculator. Let's take an example. Suppose you want to detect the incidence of liver cirrhosis in young adults using the elastography technology. The expected proportion or the estimation is around 80%. That is, all the results you'll be obtaining out of those 80% will be correct. The confidence interval is 95% and the width is set at 15%. This 15% is 15% of estimation, that is 80%. So the window becomes 72.5% to 87.5%. The results of the required sample are calculated using CTSI sample size calculator, and the link of that calculator is given below. The results are shared in the next slide. Here it is. P, it is the expected proportion or the estimation that was taken as 80%, so we have written 0.8. Width was set as 15%, and we have written is at 0.15. Confidence interval was 95%. Upon calculation, we got the sample size of 121, and expected positive results in sample is 97, that is 80% of 121. So estimation of 80% shows 97% will show positive results out of 121. So diagnosis of spectrum of disease versus non-disease. Like, it is easy to diagnose a disease when it appears in its full strength in a person with all the symptoms. Similarly, absence of a particular disease is easy to predict in a person that is normal or healthy, or it would be equally difficult to rule out a disease in a person having coinciding ailments. For example, a person having pneumonia and asthma at the same time, it is difficult to rule out which disease is present at the moment. The reproducibility of a test result solely relies on the less or no ambiguity in the overall sample size. Moving towards START. START stands for Standards for Reporting of Diagnostic Accuracy Checklist. So let's see. This list of items was developed to contribute to the completeness and transparency of reporting of diagnostic accuracy studies. The START list was released in 2015. The 30 items were identified by an international expert group of methodologists, researchers, and editors. The guiding principle in the development of START was to select items that, when reported, would help readers to judge the potential for bias in the study, to appraise the applicability of the study findings, and the validity of conclusions and recommendations. Here's the checklist. First part, it has section and topics. Numbers like 30, we already mentioned that it comprises of 30 items. Each section has further items. Like title, it has number 1 item, abstract 2, introduction has 3 and 4, like it has two items. Firstly, scientific and clinical background, including the intended use and clinical role of the index text, and secondly, study objectives and hypothesis. Similarly, methods has further domains: study design, participants, test methods. Each domain then is supported by further items, and the list continues. The next part of the list, which includes results, having 2 domains: participants and test results, followed by discussion and other information. You have to follow this checklist in order to determine the diagnostic accuracy. Now, what is gold standard? Gold standard may refer to an experimental model that has been thoroughly tested and has a reputation in the field as a reliable method. Now, what are the issues that are associated? That gold standard tests for some diseases may not be used in the clinical practice of medicine at all because the procedure is too invasive or is only applicable after death. For example, the gold standard test for Alzheimer's requires a biopsy on brain tissue, which can only be carried out post mortem. Gold standards play their role best when they are applied uniformly and blindly, as their imperfection can lead to the altered accuracy of the test result. An ideal gold standard has a sensitivity of 100% and a specificity of 100% as well. Now, the analytical tools that are used for diagnostic tests: firstly, sensitivity, we have already discussed that before; specificity, that too we have discussed before; then kappa. Kappa is used to test inter-rater reliability, and it represents the extent to which the data collected in the study are correct representations of the variables measured. Weighted kappa. It is used to measure the agreement between observed raters. ROC curves. It is actually a graph of the relationship between the two positive rates. True positive rates means sensitivity, and false positive rate. False positive rate means 1 minus specificity. Now the summary. Covering the main points that we have discussed in the presentation. Firstly, medical tests account for the requirement of patient history. There are many ways in which a diagnostic test possesses similarity to the conductance of clinical research study, that is, study structure and generalizability. Test characteristics are important parameters to understand the viability of the conducted test in response to a gold standard. The purpose of the sample size in diagnostic test is to determine the strength of evidence of occurrence of disease. Lastly, STAT checklist was developed to contribute to the completeness and transparency of reporting of diagnostic accuracy studies. Thank you so much for listening.